have the honor today of welcoming you to the 2016 Ounce of Prevention Conference. And I just joined the department last summer, so this is my first here with all of you and the department, and I am very excited to share the day with you. Thank you very much for being here. The Ounce of Prevention has brought together individuals from across the Commonwealth working to create healthier and more equitable communities. We have nearly 400 of you out here today. You look fantastic. And we are addressing a very important topic, so thank you for spending the time. It's amazing to see the breadth of stakeholders committed to this work, not only geographically, but you work in very different areas across the state, and it is really exciting to have this kind of diversity here in the room. And we are really pleased to partner with you on this. I think we are all here because we believe that everyone should have the opportunity to be healthy, everyone has the right to good health, and to make this a reality, we must and are working together to remove barriers so that everyone has the same opportunity to improve their lives and their health. Massachusetts, as you know, has long been on the leading edge of progress for health, healthcare, health reform. And I personally am thrilled to have the opportunity today to congratulate all of us on the 10th anniversary of Chapter 58, which is our Massachusetts healthcare reform. So Chapter 58 was 10 years ago today, an act providing access to affordable, quality, accountable healthcare. And it really changed the lives for so many people here in the Commonwealth, and also, as you know, served as the blueprint for the Affordable Care Act. Thanks to our work here in Massachusetts, over 400,000 people have health insurance who didn't over 10 years ago. And because of that, more residents now have a usual source of care, and there are fewer hospital admissions for complications from chronic diseases such as diabetes and hypertension. And that is well researched and documented over the past 10 years. And so while challenges remain, the progress from Chapter 58 really gives us collectively more freedom to look beyond health care to health and health equity. And today is about working together to create healthier and more equitable communities. Last week, as many of you know, it was National Public Health Week, and the public health community is rallying around a goal of making the U.S. the healthiest nation in one generation by 2030. How can we do that if we do not create healthier and more equitable communities? April is National Minority Health Month, so we have a lot to celebrate today, this week, this month. And the theme for 2016 is Accelerating Health Equity for the Nation. This is a time to raise awareness of the health disparities that continue to affect racial and ethnic health minorities and how we are working together to accelerate health equity. I am so pleased to be here today with our Commissioner, Dr. Monica Burrell, and it is an absolute honor to be part of your senior leadership team. She will provide her remarks shortly. I also have the honor of introducing shortly Dr. Gail as our keynote speaker. She is a nationally recognized leader in health policy with particular expertise and experience in issues related to social determinants of health, health inequities, and public policy issues of concern to all of us and our nation's future. I believe that she will motivate and inspire us to continue the work that we do. It is now my honor to introduce Commissioner Monica Burrell to provide the introductory remarks. Commissioner Burrell became Commissioner just over a year ago in February 2015, and she is responsible for all that we do, including the critical work of spearheading the state's response to the opioid crisis, our implementation of healthcare cost containment legislation, reducing health disparities, finding innovative solutions using data and evidence-based practices, and all of our other health care quality improvement initiatives. Dr. Burrell came to DPH widely recognized for her dedication to healthcare for underserved and vulnerable populations, and she previously served as the Chief Medical Officer of Boston Healthcare for the Homeless program, the largest nonprofit healthcare organization for homeless individuals in the country. Dr. Burrell has served on the faculty of Harvard Medical School, Boston University Medical School, and Harvard School of Public Health. She was previously at Mass General Hospital and Boston Medical Center. She has practiced general internal medicine for 20 years in neighborhood health centers, city hospitals, the VA, university hospitals, and nonprofit organizations. She is an articulate spokeswoman for the issues that bring so many of us to work at DPH, and it is a privilege and a pleasure to serve this Commonwealth with her. Please welcome Commissioner Dr. Monica Burrell.
Good morning, everyone.
Good morning.
Great to be here with you all today on this beautiful, rainy April day. And what better cause to be here for than to celebrate working together to create healthier and more equitable communities. Thanks to each one of you for everything that you do each and every day to make sure that we reach our goals. And before I go much further, I know that you want to join me in thanking my staff at DPH for making this day possible, so thank you. I'm particularly happy with the fruit options outside. And my public service announcement is that many of you know now that sitting is the new smoking. So while I'm talking, I won't be offended if you go stand, can go walk around, maybe not dance, that might be a little distracting. So I came to the Department of Health about a little bit over a year ago. I was happy to join you here last year as well. And I came with a clinical background as a general primary care internist who saw every day the impact of the social determinants of health on the medical outcomes of my patients. I witnessed firsthand the impact of these social determinants of health on health disparities and how they led to avoidable and preventable medical disease. Like you, I want to do something more about this. And like you, I've come here with you today to work together, to make our communities more healthy and rich and full. At DPH, our mission is to prevent illness, injury, and premature death and promote wellness and health for all individuals in the Commonwealth, And today I'd like to suggest to you a framework that can help our collective efforts to improve health. To give you a little bit of background about the Department of Public Health by the numbers, the department has a history stretching back to 1799 when Paul Revere headed our Board of Public Health. We have over 15 different sites in Massachusetts. Many of you work with some of our over 3,000 employees, and our budget is about $1 billion with both state and federal funding. When you look at what the Department of Public Health does, you'll see that there's a range of activities. I've listed just some of them up here on the screens. As you look and see, the important thing here in relation to the work we're doing today is to think that all the work that we do, whether it's from our epidemiology programs, to our problem gambling, to our childhood lead poisoning, to our nutrition or outreach in early childhood, all of them, it's such a broad range of what we do that it affects every citizen of the Commonwealth. So as we're affecting every citizen of the Commonwealth, we also have the opportunity to affect positive change and to make sure that we're finding health inequities where they are and focusing our resources in those areas. My view for the Department of Public Health is that we will be a national leader in innovative, outcomes-focused public health based on a data-driven approach with a focus on quality public health services and an emphasis on the social determinants and eradication of health disparities. Many people talk about this as not achievable, but this is achievable if we come together and work together to eradicate health disparities. This is my vision of our work at the Department of Public Health. The mission of the Department of Public Health remains to prevent illness, injury, and premature death, promote access to high-quality health care and public health services, and to promote wellness and health equity for all. We do that on the foundation, the red areas below, of an extremely strong and talented staff who promote everyday excellence, who bring passion and innovation to their work, and practice with inclusiveness and collaboration. And the columns in the middle are the methods for which we get to this work by using data in new and innovative ways to highlight the social determinants of health and then consistently recognize and eliminate health disparities among populations in Massachusetts. As a reminder, the social determinants of health refer to conditions of society that reflect root causes of community and individual health and well-being. They may be significant differences in the distribution distribution of these social and environmental resources with a significant association between these resources and health outcomes. These determinants drive health inequities. I'm so happy we have today Gail Christopher, who will talk more about the social determinants of health and specifically how they relate to maternal and child health. As we work together to achieve our goals of thinking about social determinants and affecting them and looking at how they impact health inequities, we can't do it without our partners in this room. And whether you're healthcare providers, housing providers, community development, or other community members, we all must be in this together. This is a pyramid that I like that comes from the CDC. It's a health impact pyramid. This is from the American Journal of Public Health. Many of you may have seen it in 2010. And if you look at this, you'll see on the left-hand side what impacts health, from the smallest impact to the highest impact. And you'll see at the top is some of the stuff that I am comfortable doing in a clinic setting, like doing clinical interventions, giving medications for blood pressure, or counseling on eating right, or getting exercise. And at the bottom are the largest impacts issues, the socioeconomic factors, such as housing and poverty. And in the green, the changing the context to make individuals' default decisions healthier. And when we think about that area in the green, that's a lot of the work that we do in public health to make sure that we all have the options to make healthy choices. Looking at some of the evidence we have here at the department, I want to highlight a few examples for you. They're striking and they need our attention. For age 15 to 24, Black non-Hispanic males, they have an average annual homicide rate almost 39 times that of white non-Hispanic males, and for Hispanic males, the rate is more than 14 times higher. 39 and 14 times higher, right here in Massachusetts. The rate of fatal occupational injuries for Hispanic workers is 80% higher, and for Black workers, it's 50% higher than for non-Hispanic white workers, right here in Massachusetts. Hospitalization rates due to asthma for Hispanic and Black non-Hispanic children are 2.5 and 3.5 times higher than the rate for whites, respectively. Among those with asthma, attack rates were higher for those 250% below the poverty line versus those 450% above the poverty line. Disparities exist for prevalence of diabetes as well. 18.2% of those earning less than $15,000 per year reported having diabetes, compared to just 5.4% of those earning more than $75,000 per year. 18% of those with less than a high school diploma reporting having diabetes, compared to 7.4% of those with at least a college education. And it goes on, 9.6% among non-Hispanic whites reported having diabetes, compared to 11.8% of non-Hispanic Blacks. As we look at this data, it reminds us that beyond the disease model, we must think about the health model and how our social determinants of health impact all of us. And I'm proud to say that Massachusetts ranks the third healthiest state in the nation. Third healthiest, just behind Vermont and Hawaii. And when you think about that, that didn't happen by accident. That happened because of decades of really strong health policy, advocacy work from people like you, and superb access to health care. And that is something we should all be proud of. But when we look at statistics like this, we know that it's our job, all of us in this room, it's our job to go beyond the means and the averages, and to look beyond that, and to make sure that all of us in Massachusetts share in this success together. I want to talk now to you about two examples of community-based work that many of you have been involved with, and some of the positive outcomes that that has had. First, I'll start with the preliminary results from the READY trial, Reducing Ethnic Racial Asthma Disparities in Youth. And this trial, as many of you are familiar, was an approach that connected community work to clinical work by having community health workers engage with individuals in their environment and their home situation, and provide education in addition to the clinical work. So thinking about where we can have the most impact on individuals' health. If you look here, you'll see the pre and post ready preliminary results show marked improvements. So the red bars show that ED visits went down, hospitalizations went down markedly, as well as urgent care use of oral steroids. And we know that when we intervene and we bring together community-based work with clinical work, we as a group collectively decrease healthcare costs. This is a focus that we will all need to have. As we think about the rising healthcare costs, the unsustainable rising healthcare costs, not only in Massachusetts, but around the country, we know from our daily work that when we connect with individuals in their communities, where they work, play, live, we know that when we make meaningful interventions there, such as this one here, that we actually save healthcare costs. And that's a powerful message that we have to keep proving and showing in this way in our work together, because we all know that it works. Here's some more results from that READY trial. So if you look here, you'll see that even environmental factors were improved, such as dust, mold, pests, smoke, and chemicals. Going to another example, I want to now look at tobacco and looking at actions taken at the retail level. This scatter plot looks at tobacco retail density by median income in Massachusetts. A picture tells 1,000 words, but I point you to the line going down the center. And you'll see that there's a very specific correlation showing that as median income increases, tobacco retail density decreases. So we know for those of us living in communities where the median income is lower, there's a higher density of tobacco retail. Looking specifically at Lynn as an example, anyone from Lynn here? Okay, we got one person from Lynn back there. You'll see here in this legend that if you break it up at the community level, you can see that the tobacco density, with the darker areas being the lower income areas, having higher tobacco retail density. Local action is the key here. To give you two examples of how at a local level we're starting to do something about this. You'll see here the example of license capping. So at communities saying that they cap the number of tobacco licenses permitted, and then pharmacy restrictions, not allowing dispensing, not allowing tobacco in pharmacies. So as we think about actions we can take at the individual and state level, these are examples of places where we can intervene successfully and look at places where the social determinants of health are impacting all of our health and make a difference. I want to turn for a minute to talk about opiates, because we need your help at the community level fighting this current opiate epidemic. You may have seen these numbers. This shows the rising rate of opiate overdose deaths in Massachusetts. In the year 2014, we predict over 1,100 deaths. Compare that to just a decade ago in 2004, when we had 456 deaths. The numbers are astounding. We are holding ourselves accountable at the Department of Public Health, measuring treatment enrollment, projecting opiate overdose death declines with the work that we're doing, and making sure that prescribers are enrolled in our PMP system. You may have heard about Governor Baker's opiate working group that he began just a month after taking office. I served on that working group, and we went around the state to understand from individuals what it will take to come together in communities and as a state to help stem the tide of this awful opiate epidemic. From that, we came up with an action plan. We came up with 65 recommendations that span across prevention, intervention, treatment, and recovery at community levels, at regional levels, and at the state level. And from that, we developed 19 action steps. You can find that on our Department of Public Health website, and I hope you will join us in this fight against this current opiate epidemic. I give you here just a few samples of some of the work that we've done so far in the last year. In the last year, we've added over 200 treatment beds to the system. We've worked to redesign our prescription monitoring system. We've introduced core competencies for the first time in the country that go across medical schools, dental schools, and other prescribers, so that students who are learning to be prescribers are learning how to balance the need for pain relief with the potential for opiate misuse. We've held drug take-back days. We've convened a state drug formulary, and we've transferred women who were civilly committed under Section 35 at NCI Framingham to start Taunton State Hospital. All of these are just examples of the work we're doing. We need your help, most importantly, to work with us to fight the stigma of opiate addiction and to make sure we all understand this as a chronic medical disease, where we need to make sure that those in our communities have access to treatment and the care that they need. So I'll end with this, because for me it starts and ends with the patients I've taken care of and their stories. I've given you a lot of numbers, but behind each one of those numbers is an individual, a family member, their community. In my last year at Boston Healthcare for the Homeless, I started to ask my patients, what will it take to make you healthy? And after doing this work for decades, really, I was slightly surprised by their answers. A few of them said it's the diabetes medications you give me, or the high blood pressure medicine, or the reminder to make sure I eat right. But most of their answers were something like this. What will it take to make you healthy? A place to live other than the shelter, where I can get rest and heal. The ability to make right choices, to eat right, and not be around people who smoke. I want to see my children. I need a place to live, a home. I need to get better with hope and dignity. You see, these are the things that matter to anybody. Staying healthy, being connected to those in our community, and being well to all of us, no matter where we come from. The work you do in this room, each one of you, is so empowering to those who need it most. You work to keep us all healthy. I can't thank you enough for your partnership with us as a department. We have a lot of work to do. It'll take all of our energies. Thank you for being here, and thank you for staying committed to this work. Thank you.
I am now pleased to have the opportunity to introduce our keynote this morning. Dr. Gail Christopher is Senior Advisor and Vice President at the W.K. Kellogg Foundation. In this role, she leads the Foundation's Truth, Racial Healing, and Transformation enterprise and serves on the President's Cabinet that provides overall direction and leadership for the Foundation. Since joining the Foundation in 2007, you're almost at your decade, Dr. Christopher has served as Vice President for Program Strategy with responsibility for multiple areas of programming, including racial equity, food, health, and well-being, community engagement and leadership, as well as place-based programming in New Orleans and New Mexico. Dr. Christopher is a nationally recognized leader in health policy with particular expertise and experience in the issues related to social determinants of health, health inequities, and public policy issues. Her distinguished career, do you want me to stop? Her distinguished career and contributions to public service were honored in 1996 when she was elected as a Fellow of the National Academy of Public Administration. In 2011, she was awarded the Change Agent Award, it's a pretty good title, by the Schott Foundation for Public Education, and in 2012, she was the recipient of the Association of Maternal and Child Health Programs John C. McQueen Lecture Award for Innovation and Leadership in the Field of Maternal and Child Health. Most recently, just a couple more things here, she was the recipient of the Terrence Keenan Award for Grantmakers in Health. She is president of the board of the Trust for America's Health. And as I noted earlier today, April is National Minority Health Month, and a terrific opportunity to raise awareness of the health disparities that continue to affect racial and ethnic minorities, and how we are working together to accelerate health equity. How fortunate that we are able to host you today as you discuss influencing the social determinants of maternal and child health. Please help me welcome Dr. Gail Christopher.
Joy to have been invited to be with you today. What an honor to have heard the commissioners presenting at what we would consider healthy foods. He's talking about yogurt and energy bars and all these things that we think are healthy, and if you read down the label, very quickly you will consume over 40 grams of sugar. But what he also does in this film is document over just 60 days the metabolic and biochemical changes that occur in his body by deliberately taking in 44 grams of sugar a day. It's an astounding and a very powerful film. It wakes people up, and they start reading labels, and they start changing their decisions. And they start feeling and thinking better within a matter of 48 hours. Ultimately, if we're going to mitigate the legacy of this belief in a racial hierarchy, we have to do two things. We have to dismantle the belief itself and replace it with the truth of our being and our connectedness as a human family. But we also have to mitigate the exposures to the discrimination and the inequities that come from that legacy. And so a lot of the work that we do as public health leaders is in that mitigation category. So we need to make sure, for example, that the life course of young women who are going to become pregnant, that the life course, the nutrition, the reduction in exposure to stress and violence and discrimination, that all those things help them to be prepared to deliver healthy babies. We have to make sure that the infant that is born has access to mother's milk. Now, when we first started pushing breastfeeding at the foundation, oh my goodness, people said, are you serious? But there is a movement in this country now to optimize access to mother's milk for 6 months. And what a difference it makes in the life trajectory of the child and the mother. We started this work out because we're committed to children. And then we started to see the research on how this breastfeeding process protects the mother against breast cancer, uterine cancer. It reduces her risk, heart disease, even macular degeneration. Now, of course, I'm curious to know what is it about the act of breastfeeding that would trigger those kinds of protections or reduce risks for the mother. We don't have the data, but it appears that it has something to do with the hormonal dynamics during that process. People talk about oxytocin as the moral molecule and how it helps to generate this need, this acknowledgement of the need for connection to other human beings, which is a fundamental human need. We need more of that. And we certainly need to optimize the breastfeeding experience because it will make a difference in health outcomes throughout the life of the child and of the mother. And we aren't there yet as a country. We're not where we need to be. We have a lot of work to do for the sustained benefit of breastfeeding. We have a high initiation rate, but we don't carry it all the way through. The nutrition component, in my mind, is another one of those critical mitigating factors. Not only getting rid of the processed sugar, but providing access to fresh, whole foods and not having to spend a whole paycheck to get them. So much of what we're dealing with today, as your commissioner said, is avoidable in terms of a disease burden. But we have to do some transformational work in our communities to make sure that not only is the food available, but it's consumed and there's a relationship to the food that makes it make sense to the individual. And that gets us into education. We all have our work to do in this space, but we grow and we become more effective as human beings when we do that work. When we embrace our full humanity with all its blotches and spots and vulnerability, and we embrace the full humanity of others, because we cannot give what we don't have. I will either project my low self-esteem onto others, or I will extend my value for self to others. And so this work, this healing work, is full circle. But it is public health work. It is certainly critically important to the health of the next generations. And I know, because I've seen Massachusetts do it, I have confidence that this state will lead the nation in doing that work and doing it well. Thank you all very much.
Extraordinary work taking place across the Commonwealth to create healthier and more equitable communities. I am pleased to be up here with Commissioner Burrell and Leah Susan Oyama as we present the Commissioner's Leadership Award and the Peter R. Lee Healthy Communities Award. It is always challenging to select just one from such a deserving pool of nominations. Commissioner Burrell will present our first award.
Hi everyone. It's that time of awards, and I'm so privileged and excited to present the Commissioner's Leadership Award. This award recognizes exceptional leadership in promoting healthier and more equitable communities. This award acknowledges and celebrates the extraordinary work of an individual in convening multiple partners to work together for healthier communities. I'm so pleased to award the 2016 Commissioner's Leadership Award to Wendy Garflip of United Neighbors of Fall River. Wendy comes up, let me tell you a little bit about her work. Wendy has provided strong leadership to support children and strengthen families by coordinating resources and increasing neighborhood-based activities. Come on up here. Stand next to me, there you go. To re-engage with their children. Oh, I lost my spot because I got so excited. Hold on. You don't want to miss any part of Wendy's extraordinariness. Wendy has organized Nurturing Fathers programs that invite non-custodial parents to learn positive parenting skills so they can earn the opportunity to re-engage with their children. Wendy spearheaded the creation of a citywide 30-member coalition to respond to the influx of hundreds of homeless families into motels in the Fall River area. Wendy helped form a new suicide prevention coalition that is focusing on the rising incidence of attempted and successful self-harm and its impact on family members and friends. As a result of her efforts, young fathers are routinely referred to the Nurturing Fathers program, which has had to add a third group to accommodate all the referrals. The Department of Housing and Economic Development has now incorporated local support resources into their approach to working with homeless families throughout the Commonwealth. Fall River schools now support system-wide violence prevention efforts and encourage involvement of students in planning their own programs during and after school hours. Wendy has demonstrated long-term commitment towards improvement of community health, and through this award, Wendy is recognized for her dedication to improving the health of Fall River. Please join me in honoring Wendy Garflip as the recipient of the 2016
Good afternoon, everyone. And I'm proud and humbled to be the recipient of this award. Although I'm the one to physically stand up here to accept this award, This is a large group of my colleagues that should be up here sharing this honor. I began my work as a peace advocate, working in 7 Middle Eastern countries in the early 70s to bring about peace. Clearly, we failed. But I quickly learned the lesson that has become the mantra for the work that I do now. No one is interested in peace if they don't have food to eat, or clean water, education for their children, a roof over their heads, and access to health care. I learned that health care is community care, utilizing the World Health Organization's definition of health that encompasses high levels of community participation, a focus on prevention and staying healthy, a nonviolent and safe community, affordable housing, employment and education, accessible recreation, safe and healthy workplaces, transportation systems, and healthy and safe environments. All of these are the components of good health. And taken together, these are the elements needed to bring about positive change to our communities. No one presents with just one issue. You might sit across from a family asking for food support, but underneath it all, there's a plethora of issues that are compounding the lack of food, be it access, availability, nutrition knowledge, transportation, money, and so on. No one agency or individual has the capacity to solve these complex problems by themselves, but only through the collaborative work of colleagues can we achieve positive outcomes for our families. I'm very cognizant of the fact that our best outcomes are achieved with collaboration. I'm very fortunate to have ended up in Fall River, a Robert Wood Johnson Foundation Culture of Health community, where Greater Fall River Partners for a Healthier Community, Chana 25, has provided the collaborative support that has enabled us to achieve such positive outcomes in Fall River. As a Chana, Partners reaches beyond any one agency. Since a Chana is comprised of people from all segments of the community, it enables us to tackle problems with diverse support and expertise in a holistic manner. All segments of the community need to come together to bring about positive outcomes for our residents, and the Chana makes this possible. My small agency would never be able to achieve all those things that the Commissioner just said if Chana 25, Greater Fall River Partners, did not create the space for innovation, collaboration, and creativity. Grateful thanks to Partners and its small p partners, and special thanks to Dr. David Weed and Marsha Picard, 2 of the driving forces that are helping to transform Fall River. This moment is much bigger than me. This moment is for every one of the collaborating partners who contribute to the culture of health that we are creating in Fall River. And this moment also belongs to all of you, who work collaboratively for health outcomes for the residents of Massachusetts. To quote a senator from the great state of Vermont, I'm going to do my best to try and create a country in which children are not living in poverty, in which kids can go to college, and in which old people have health care. Will I succeed? I can't guarantee you that, but I can tell you from a human point of view, it's better to show up than to give up. So thanks to you all for showing up. Keep showing up. And together, we will make a difference. Thank you.
So I'm Leah Susan Oy. I direct the Division of Prevention and Wellness at the Department of Public Health, and I have the honor of presenting the Peter R. Lee Healthy Communities Award, which honors a coalition or partnership for their collaborative work to create healthier and more equitable communities. This award is named for Peter Lee. Like many of you in this room, I had the pleasure of working with Peter closely over many years. Peter was the late director of the Massachusetts Partnership for Healthy Communities at Health Resources in Action, and was a leader in healthy communities movement in Massachusetts and across the country before his death in December 2012. Peter personified the principles of healthy communities in his professional and personal life, and was a longtime participant and organizer of the Ounce of Prevention Conference. The 2016 recipient of the Peter R. Lee Healthy Communities Award is Age Friendly Berkshires. Age-Friendly Berkshires represents a multi-sector collaboration established to brand the Berkshires as a good place to grow up and a great place to actively age. Councils on Aging, Boards of Health, the Berkshire Regional Planning Commission, Transportation and Housing Agencies, Elder Services, the Berkshire Elder Care Network, the Chamber of Commerce, Berkshire Health Systems, Berkshire Community College, and many others came together to have an open dialogue about how the transformative changes of our rapidly aging population would affect the community. I must, and this is where I'm going to go off my script, which is maybe going to mess me up, but when I read your application, I thought so much of Peter, because Peter and I had dialogues about the importance of where land use, transportation, and health intersect. He was on the Metro Future board before anybody thought about integrating planning and public health, so I read this application, and it just, you have the people at the table that Peter dreamed of seeing as a multi-sector partnership. Now I'll go back to my formal thing, but that's, I wanted to say that. But it really is a group of unlikely partners came together to ask questions about what they want their future to look like, how they will age in the Berkshires, what it means to actively age, and explore how prepared they are. Age-Friendly Berkshires has taken data provided by the Mass Healthy Aging Collaborative and the Berkshire Regional Planning Agency to bring together a diverse group of stakeholders from across many disciplines to create a regional approach to age-friendly communities. Please join me in honoring age-friendly Berkshires with the 2016 Peter R. Lee Award. You're all clapping, so I'll tell you this is Laura Kittros and Celeste Roller Harper here today to represent age-friendly Berkshires.
Well, the first thing I want to say is that Celeste and I are really the substitutes. The person who should be up here accepting this award is Bobby Horsey, who was unable to come today. And Bobby was really the visionary behind this. This is a program that's only been operating for about 2 years. We've come a huge way in 2 years and accomplished a lot, and we still have a lot to accomplish. She was not only the visionary, but she was kind of the driver behind getting many of us involved in showing us that not only is Massachusetts and the United States aging, but in Berkshire County, we're doing it faster and sooner than anyone else. We already have the majority of our 32 municipalities with 40 to 50% of the population over the age of 50, and by 2030, which is sooner than we think, more than 60% of those populations are going to be over the age of 50. And that's in Berkshire County. That's not only because we're all aging, but also because we're losing our young people. As a rural area without a lot of industry anymore, we talk about our missing population from age 20 to age 40. So that's really what we're embracing with Age-Friendly Berkshires, is that it's not simply a place to grow old well, although that's obviously a primary focus, but it's a good place for all people. It's a good place to grow up, and it's a good place to grow old.
Thank you, Laura. Again, I have to also reiterate Laura's sentiments about this is really a champion effort from Bobby. And I have to say that my first thanks is to, of course, Laura and Bobby, because they're the ones to help write the grant to get me here today. So we have an incredible volunteer support group. It's really about systems building. And I think it's sort of apropos that that I'm here today. I don't have my MPH. I'm actually a land use regional planner with a lot of experience in talking with the community and getting these dialogues working and making sure that it's cross-sector collaboration. If we don't get everybody to the table, what are we going to do? We're not going to get a lot of collaborative work happening because we're working in our own silos. So it's about breaking, that isomorphic systems issues that we have, and it's everywhere. So on to my many thank yous, and I will try to keep this very quick. But again, so a big thank you to Bobby Horsey, who along with Laura helped to catalyze this momentum for Age-Friendly Berkshires and hiring me, writing the grant to allow us as a large group to pursue this program. And also a big thank you to, of course, the World Health Organization and AARP to allow us to implement the Age-Friendly Cities and Communities programs, international in scope, and AARP is their collaborative partner in the United States. And a huge thank you to Tufts Health Plan Foundation in allowing us to implement this through their very generous grant support. And lastly, a huge thank you to, of course, my task force that I answer to on a monthly basis. They are the lifeblood of age-friendly Berkshires. With their interest, guidance, and support, this is turning out to be a really great program where, again, this has been a 2-year process, but I've been around since December, and we're only growing in momentum and with community members joining our task force. And of course, thank you to DPH. Huge, huge thank you to them. And also, they've also helped us along the way with actually Mass in Motion programming support. So that, again, I want to make sure that I let you guys, the audience, know that we really do appreciate that. And also to Health New England for also funding a few programs that we've been able to implement. So this is a wonderful aggregated amount of programming throughout the whole county, which is amazing. And of course, in recognizing, another thank you to DPH in recognizing our efforts and awarding us the Peter R. Lee Award. We are truly humbled and honored. So thank you all very much. Enjoy your lunch.